Hello everybody, my name is Ayush Singh and today we are going to go over the topic of routes of drug administration. Most of the drugs can be administered by different routes. Drug and patient related factors determine the selection of routes for drug administration. These factors are characteristic of the drug, emergency or routine use, condition of the patient, age of the patient, associated diseases, patient's or doctor's choice. So the routes are divided into two parts, local and systemic. Systemic routes are divided further into two parts, enteral and parenteral. Local route, it is the simplest mode of administration of a drug at the site where the desired action is required. Systemic side effects are minimal, and the following are the types of local routes. Firstly, topical. The drug is applied to the skin or mucous membrane at various sites for localized action. For example, oral cavity, GI tract, rectum and anal canal, eye, ear and nose, bronchi, vagina, urethra, skin. Second, it is intra-arterial route. This route is rarely employed. It is mainly used during diagnostic studies such as coronary angiography and for the administration of some anti-cancer drugs like for treatment of malignancy involving limbs. Administration of drug into some deep tissues by injection, example administration of triamcinolone directly into the joint space in rheumatoid arthritis. Systemic routes. Drug administered by this route enter the blood and produce systemic effects. Enteral routes. They include oral, sublingual and rectal routes. Oral route. It is the most common and acceptable route for drug administration. Dosage forms are tablet, capsule, syrup, mixture, etc. Like paracetamol tablet for fever, omeprazole capsule for peptic ulcer are given orally. Advantages: safer, cheaper, painless, convenient for repeated and prolonged use, can be self-administered. Disadvantages: it is not suitable for or in unpalatable and highly irritant drugs, unabsorbable drugs, drugs that are destroyed by digestive juices, drugs with extensive first pass metabolism, unconscious patients, uncooperative and unreliable patients, patients with severe vomiting and diarrhea, not suitable for emergency as onset of orally administered drugs is slow. Sublingual route. The preparation is kept under the tongue. The drug is absorbed through the buccal mucosal membrane and enters the systemic circulation directly, like nitroglycerin for acute anginal attack and buprenorphine for myocardial infarction. Advantages: quick onset of action of the drug. Action can be terminated by spitting out the tablet, bypasses the first pass metabolism. Self-administration is possible. Disadvantages: it is not suitable for irritant and lipid-soluble drugs, drugs with bad taste. Rectal route. Drugs can be given in the form of solid or liquid, like suppository and enema. Suppository can be used for local effect as well as systemic effect, like indomethacin for rheumatoid arthritis. Retention enema can be used for local effect as well as systemic effect. The drug is absorbed through rectal mucosal membrane and produces systemic effect, like diazepam for status epilepticus in children. Parenteral routes. Routes of drug administration other than enteral route are called parenteral routes. Advantages: onset of action of drugs is faster, hence suitable for emergency, useful in unconscious patients, uncooperative and unreliable patients, patients with vomiting and diarrhea, suitable for irritant drugs, drugs with high first pass metabolism, drugs not absorbed orally, drugs destroyed by digestive juices. Disadvantages: require aseptic conditions, preparation should be sterile and is expensive, require invasive techniques which are painful, cannot be usually self-administered, causes local injury to nerve and vessels. Inhalation. Volatile liquids and gases are given by inhalation for systemic effects like general anesthesias. Advantages: quick onset of action, dose required is very less so systemic toxicity is minimized. Amount of drug administered can be regulated. Disadvantages: local irritation may cause increased respiratory secretion and bronchospasm. Injections. Intradermal route. The drug is injected into the layers of skin like BCG vaccination and drug sensitivity tests. It is painful and a small amount of drug can be administered. Subcutaneous route. The drug is injected into the subcutaneous tissues of thigh, abdomen, arm like adrenaline, insulin, etc. Advantages: self-administration of drug is possible, example insulin. Depot preparations can be inserted into the subcutaneous tissue like Norplant for contraception. Disadvantages: it is suitable only for non-irritant drugs. Drug absorption is slow, hence not suitable for emergency. Intramuscular route. Drugs are injected into large muscles such as deltoid, gluteus maximus, and vastus lateralis, like paracetamol, diclofenac, etc. A volume of 5 to 10 ml can be given at a time. Advantages: absorption is more rapid as compared to oral route. Mild irritants, depot injections, soluble substances, and suspension can be given by this route. Disadvantages: aseptic conditions are needed. Intramuscular injections are painful and may cause abscess. Self administration is not possible. There may be injury to the nerves. Intravenous routes. Drugs are injected directly into the bloodstream through a vein. Drugs are administered as bolus, single relatively large dose of a drug injected rapidly or slowly into a vein, like IV ranitidine in bleeding peptic ulcers. Slow intravenous injection, for example, IV morphine in myocardial infarction. Intravenous infusion, for example, dopamine infusion in cardiogenic shock, mannitol infusion in cerebral edema, fluids infused intravenously in dehydration. Advantages: bioavailability is 100%, quick onset of action, so it is the route of choice in emergency. Example, intravenous diazepam to control convulsions in status epilepticus. Large volume of fluids can be administered, like intravenous fluids in patient with severe dehydration. Highly irritant drugs, like anti-cancer drugs, can be given because they get diluted in blood. Hypertonic solution can be infused by intravenous route, like 20% mannitol in cerebral edema. By IV infusion, a constant plasma level of drug can be maintained. Example, dopamine infusion in cardiogenic shock. Disadvantages: local irritation may cause phlebitis. Self-administration is usually not possible. Strict aseptic conditions are needed. Extravasation of some drugs can cause injury, necrosis, and slowing of tissues. Depot preparations cannot be given by IV route. Precautions: drugs should be usually injected slowly. Before injecting, make sure that the tip of the needle is in the vein. Intrathecal routes. Drug is injected into subarachnoid space. Example, lignocaine in spinal anesthesia. Antibiotics like amphotericin B. Transdermal route. The drug is administered in the form of a patch or ointment that delivers the drug into the circulation for systemic effect. Example, scopolamine patch for sialorrhea and motion sickness. Nitroglycerin patch for ointment for prophylaxis of angina. Estrogen patch for hormone replacement therapy. Clonidine patch for hypertension. Fentanyl patch for chronic pain. Nicotine patch for tobacco de-addiction. Advantages: self-administration is possible, patient compliance is better, duration of action is prolonged. Systemic side effects are reduced, provides a constant plasma concentration of the drug, first pass metabolism is bypassed. Disadvantages: expensive, local irritation may cause dermatitis and itching, patches may fall off unnoticed. Special drug delivery systems. They have been developed to prolong duration of drug action for targeted delivery of drugs or to improve patient compliance. Occusert. It is kept beneath the lower eyelid in glaucoma. It releases drugs slowly for a week following a single application. Example, pilocarpine. Progestasert. It is an intrauterine contraceptive device that releases progesterone slowly over a period of 1 year. Liposomes. They are minute vesicles made of phospholipids into which the drug is incorporated. They help in targeted delivery of drugs. Example, liposomal formulation of amphotericin B for fungal infections. Monoclonal antibodies. They are immunoglobulins produced by cell culture. Selected to react with specific antigen. They are useful for targeted delivery of drugs. Example, delivery of anti-cancer drugs using monoclonal antibodies. Drug-eluting stents. Example, paclitaxel releasing stents used in coronary angioplasty. Computerized miniature pumps. Example, insulin. Thank you. That's all for today.